Hello and welcome to an enriching series of lectures that I am truly delighted to bring to you. I am Karthik Kallennavar from College of Agriculture Vijayapura, University of Agriculture Sciences Dharavada. Over the course of this series, I will be delivering related to livestock and poultry healthcare. I am humbled to share insights and knowledge on the topic of uterine prolapse in cattle. First of all, we know what is prolapse. A prolapse literally means falling down or downward displacement of a part from its normal anatomical position. In prolapse, there are two types: vaginal prolapse and uterine prolapse. Uterine prolapse: falling, sinking, sliding of uterus from its normal location in the body, seen immediately or after some time of calving. You can see here the image of uterine prolapse. Compared to vaginal prolapse, it is larger, longer, usually hanging down to the hocks when standing, more deep red in color when covered with caruncles. Frequent sequel lead to protracted dystoxia. Dystoxia means difficulty in parturition. Most commonly observed in cows, buffaloes, ewes. Prognosis guarded to grave if no immediate veterinarian aid. Etiology: predisposing factors, lack of tonicity of uterine musculature, extensive manipulation to relieve dystoxia, secondary uterine inertia, uterine prolapse. Secondary uterine inertia means it is the result of failure in contraction of empty the uterus causing fatigue to the myometrium. Exciting factors: expulsive efforts of an dam or manipulative interventions for removal of membranes, presence of part of fetal membranes in genital passage, strong tenesmus and prolapse. Tenesmus means is a feeling of being unable to empty the bowel or bladder. You can see here the image of secondary uterine inertia. These are the symptoms of parturition of cattle that leads to the uterine prolapse. Clinical signings: hypertrophied caruncles and exposed endometrial surface. Depending on duration of prolapse, color changes to dark red with foci of necrotic tissue. If prolapse of intestine through rupture in uterus wall. Strangulations: shock. Strangulations means compression of the tubes such as trachea or arteries causing interruptions of blood supply to brain. Anorexia. Anorexia means below normal weight through starvation in the cattle. Pyrexia. Pyrexia means increase in the body temperature or fever. Dyspnea. Dyspnea means shortness of breath in later stages. Incontinence of urine. Incontinence of urine means cattle loses its control over its urination, restlessness and tenesmus. Strangulations. Anorexia means loss of body weight through starvation. Pyrexia means increase in body temperature or fever. Dyspnea means shortness of breath. This is the incontinence of urine, that the cattle loses its control over of urination. Tenesmus. Tenesmus means feeling of being unable to empty the bowel or bladder. Treatment. There are 3 steps in treatment. Those are reduction, replacement, amputation. This decision depends upon following factors: placenta, trauma, gross hemorrhage. First, reduction. The uterine prolapse is reduced through first caudal diural anesthesia, thorough cleaning of prolapsed mass with cold water, or mild antiseptic solutions like acryflavin. Evacuation of urinary bladder if necessary by catheterization. Suturing uterine tear if any. Application of hygroscopic substances to reduce size such as cold alum solutions 50% dextrose, magnesium sulfate. Lubrication with non-irritant liquid or jellies. Glycerin provides lubrication, reduces congestion and edema by osmotic action. Edema means swelling, and also through anesthetic jellies. These are the areas desensitized through epidural anesthesia: tail, vulva, perineum, posterior vagina, cessation of abdominal contractions, udder, hind limbs causing recumbency. Catheterization means removal of urine through urinary bladder using the instrument called catheter and the process called catheterization. These are the catheters. Second stage is replacement of the uterus to its normal location. After lubrication, replacing prolapsed uterus beginning from area nearest to vulva. Better to begin with ventral surface and alternate it with the dorsal surface. After replacing major part, pushing ovarian pole through cervix and uterus using closed piston fashion. Pushing several liters of warm water into uterus to completely replace the ovarian pole, then siphoning out of water. Immediate administration of 50 to 60 units of oxytocin and fourth calcium therapy for resumption of uterine tonicity and to fasten involution process to prevent recurrence. Retention method similar to that of vaginal prolapse. Replacement of uterus. This is the image that shows pushing the uterus in fist like piston fashion. Amputation. Indications: good removal of placenta not possible without gross trauma and hemorrhage resulting, gross damage with continuous hemorrhage, permanent devitalization of uterus, gross internal hemorrhage. Trauma means feeling uncomfortable or difficulty. Gross hemorrhage means vomiting dark color red from dark color blood sufficient to produce weakness in the body. This is the removal of uterus through thread. And also there are many techniques. From that one is illustration technique. Crude but practical method of correction under range conditions. Application of elastic ligature or heavy rubber tubing about 4 to 6 cm distal to cervix, going around uterus 3 to 4 times and tightened each time. No suturing is required. Produces tissue strangulation and within few days dropping of affected part. These are the illustration techniques used in cattles. Thank you for this watching video.